We are going to discuss about doctor-patient relationship. So, in this society, do you think there should be great relation between doctor and patient for successful treatment and care? Of course, yes. If the doctor don't wins the confidence of the patient, then the treatment absolutely gets failed. So, the best one is communication. So, how should a doctor communicate the patient for better care and better cure? So, this is our topic for today. Let's discuss it. So, doctor patient relationship. As future doctors, we must know how to communicate with the patient. There are three levels of communication. One is communication on the emotional plane. So, you should give sympathetic ear to the complaints made by the patient and relatives without any hesitation or irritation or any anything. We should listen to them carefully and patiently. So, we should build a quick rapport with the patient. So, we should ask the details of the patient, and we should ask what happened to him. Everything we should listen, whatever he says, we should listen with a sympathy. Even if it is not related to our history, we should give a sympathetic ear to him, so that it builds a quick rapport and confidence of the patient, and we should address him with his name every time. Okay. So, communication on the cultural plane. Doctor should be aware of general concepts of the culture, social organization of the community. So, in this aspect only, folk medicine comes into play actually, because the patient feels comfortable with the folk man who prepares the medicine from the plants, and he gave everything in a cultural manner. So, the doctor must know the culture of the community for a successful communication and for successful treatment of the patient. So, if he don't know the cultural aspects, he can't able to build full confidence of the or achieve full confidence of the patient. So, he should know the general concepts of the culture and social organization of the community. So, it acquires a flexibility in the dealing with the patient. He can easily deal with the patient if he knows everything. So, a mere statement to the patient. So, in some communities, there will be classification of the diseases: cold disease, hot disease, like that. In those cases, the doctor should not hesitate or should not get into a doubt, how can I manage. So, he should imply some humor um, and some statement like this: a mere statement to the patient that the medicine is hot, which help you to cure the cold disease, builds him extreme confidence in the doctor and helps him to adhere to the treatment. Communication of the intellectual plane. As there is wide gap between the doctor and patient, because the doctor is who studied 5.5 years of medicine, and he has great intellectuality. The patient may be illiterate, so there is wide gap in between the knowledge and in the intellectual plane also. So, the doctor, a successful doctor, should reduce this gap and should able to share everything with the patient freely regarding the treatment, or regarding his symptoms, regarding in a friendly manner. So, he can establish a good doctor patient relationship at that time. So, there is enormous social distance between the two groups. So, a successful doctor must reduce this gap. And another important component he should include while treating the patient is humor. So, a sense of humor will definitely make the patient feel comfortable with the doctor. So, these three we should be following for successful doctor patient relationship. As we are going to become doctors within like 1 year, like if after third year exams and after fourth year complete, we'll be probably doing internship. We should probably know what are the levels of communication and how should we interact with the patient, how should we treat the patient with his history only, and how should we listen to carefully. If we can't able to make the patient feel comfortable, he can't say anything to us properly, and it may land up in wrong diagnosis and we may also miss out some of the findings in the uh, report scannings and everything. So the main aim of this video is to build a successful doctor patient relationship. Thank you guys, thank you.